Welcome to The Big Picture. You know, the human body is a pretty good design. We have 2 eyes and 2 ears, and thankfully sometimes only 1 nose. But you know what? Try and get dressed someday when you only have 1 arm. When things go wrong, it's a little difficult because you're not used to only a partial part of the body to work with. That's particularly true when it comes to your eyes, because if you can't see what's going on around you, you can't do anything. That's the problem, especially when problems pop up, like as you get a little bit older and things become fuzzy, or maybe, God forbid, when you're in college and your best friend hits you in the eye with a racquetball. I'm not going to mention any names. But on that topic, we have a guest today who might be able to tell us a little bit about eye problems. Dr. Michael Murphy from Clarence Eye Care, who is here to tell us a little bit about what happens when eyes start to misbehave. Mike, welcome to the show.
Thanks, Phil. I appreciate you having me. I'm excited to share some information with everybody.
Well, the first question I have is, you deal with this every day, eye problems. You see young people, you see old people. What's, in your experience, what's the most common problem that people come in and have, you know, just basically fuzzy vision? I mean, what do you see every day?
I would say blurry vision is the most common thing that gets people to come in either for glasses or contact lenses. But with the use of cell phones and computers and a lot of near-point work, a lot of people suffer from dry eye. It affects probably 30 million people in our country today. And that's just overuse of our visual system, not blinking enough, symptoms that can cause blurry vision, fluctuation in vision, burning, itchy, teary eyes.
Now you say, with the advent of cell phones and screens in general, I hadn't thought about that. People do kind of lose their concentration when it comes, well, the normal reactions, you say they don't blink as they look at a screen, they kind of don't automatically do what normal.
So our normal blink rate is 22 times a minute. And if we stare at a screen or look at a phone, it drops to 7 times a minute.
Wow, that's amazing.
We've got little glands in our lid that only secrete tears when we blink. So when our blink rate goes down, we get evaporative dry eye. The surface of the eye dries out.
That's amazing. I didn't realize that and that's because you're concentrating on that motion on the screen. And
that's right.
I thought it was just an automatic process that you blink whenever you need to blink. That's not the case.
You'll eventually blink, maybe because your vision's gone blurry or because you're feeling dry. But we have a lot of patients that experience these symptoms that need to come in and either be treated with artificial tears or prescription drops. And it's a really cool technology that maybe we can talk about a little bit later that is just coming into the market now.
Now, you see this mostly with younger people? The screen technology is kind of affecting?
We're seeing dry eye in every age range. We're seeing kids at, you know, sometimes 3, 4, 5 years old because they're on screens, you know, at the age of 1 or 2.
Wow.
We're seeing people in their, you know, 70s and 80s that have dry eye. So it runs the whole gamut.
Now, when you say dry eye, and I've had a little experience with this, does that manifest as watery eye at times? I mean, people are tearing up too much, or what do you mean by dry eye?
So dry eye can present as overaction of your tear production, which can cause tearing or watering, and people don't always associate that with dry eye. But people can experience itchy, burny, teary, fluctuation in their vision. They'll come to us and we'll do some diagnostic tests to figure out what is the problem. Is it a gland function? Is it a lack of blinking function? Is it a chronic inflammatory, you know, disease or issue? And then based on the symptoms and based on our findings, we'll prescribe the appropriate medication or treatment to fix that.
Do people normally just to say, oh, you know, I've got, you know, itchy eyes, I'm going to put an eye drop in, and, you know, and leave it at that until it gets to a certain point, and then you see them?
So the problem with dry eyes, it's an inflammatory disease. So there's inflammation of the glands that are making your healthy tears. And so there's very few things that treat inflammation and treat the actual disease process and the symptoms and create a healthy environment for the surface of the eye. If you put tears in, you're just lubricating the eye. You're not treating the underlying problem. So that's a good starting point, and that's a place that we recommend everyone starts. But you can do, vitamins. Omega-3 fish oil is really good quality fish oil. You can do punctal plugs where you put a little plug in the drainage duct of the lid. We can sometimes prescribe steroids or prescription drops that you might use that you put in a couple times a day.
And one of the things I was going to ask you is, meds that you prescribed or vitamins that people can use just to preserve the function and the health of their eyes. Like, for instance, I read about lutein some years ago, and I take lutein on a regular basis, and I don't know whether it's genetic or whether it's the lutein that I take, but my eyes seem to be in relatively good shape for my age. Is lutein or other vitamins, supplements worth considering?
Absolutely. So I have a strong family history of macular degeneration. Macular degeneration comes from genetics, smoking, poor diet, age. And so we can all do some things to try to slow that disease process down. In my opinion, lutein, and then to go above and beyond that, zeaxanthin and mesozeaxanthin are 3 pigments that are found in the back of your eye. And you can supplement. There's a lot of good quality manufacturers that make those products that you can take on a daily basis. And independent studies show that these are great for your eyes, and they might even be great for your brain function too.
Well, first of all, how often should somebody come in to you to get a regular checkup just to make sure their eyes are in decent shape and get a new prescription if they have contacts or glasses or whatever? Yeah. What's a regular checkup?
We recommend a yearly eye exam. There's a lot of things that can go undetected by yourself without a good back of the eye check, without a thorough evaluation. There's a lot of debate about there. Should it be a year? Should it be 2 years? I like to tell my patients every year because we all get busy, and 1 year turns into 2 sometimes. Mm-hmm. And if I tell them 2, it turns into 3. Yeah. So I like to tell my patients every year. Well,
that's one thing I never thought about asking when I go for a checkup, and that is, hey doc, are there any vitamins that you recommend? So that's a good thing if you are having a checkup. That's a good thing to ask. I mean, that's something that I hadn't thought about,
There's some great manufacturers of vitamins. I'm a big fan of vitamins that are third-party tested. There's something called the NSF, the National Sanitation Foundation. And this corporation does third-party testing to make sure that what's in the vitamin is actually in there. Mm-hmm. And not every vitamin is regulated that way. We all know the FDA does not regulate the vitamin industry. So if you are going to spend money on vitamins, in my opinion, you should be taking something that's high quality.
Okay, other than what we've just talked about with the screen-related and the dry eye and the irritation, the common problems from young to old.
So there's a big shift in optometry and eye care in the last several years regarding the severe progression of myopia in our children because of the indoor time, because of the close work and screen time that we're doing. And so nearsightedness and myopia is exploding, and offering just glasses and contacts is no longer, in my opinion, the best solution. We need to offer our children things like orthokeratology or something called MySight lenses. And these are treatment options for young kids that they can wear as a contact lens either overnight or during the day to actually slow the progression of their nearsightedness.
Mm-hmm. I have read in the past articles, at odd times, that you could actually exercise your eyes. I mean, and I'm not sure, I haven't gotten into the specifics of what they're recommending, but is there such a thing as basically, making your eyes a little better by reading at odd times or looking at distances and then looking close up and so on? Is that such a thing?
There's doctors that specialize in that type of a profession called vision therapy, and they're fantastic at it. And they work with patients who have issues with eye muscle alignment and how the eyes work together. A lot of people suffer from a binocular vision disorder called convergence insufficiency. When we read, we need our eyes to turn in so we can keep a nice, clear, single target as we read. Otherwise, we end up rereading the same line over and over again, trying to keep our place. And so through an evaluation with a doctor that does that and doing an office modality therapy, you can actually train the muscles to work better together. What we've incorporated into our office recently is a technology called NeuroLens. And NeuroLens is a device that actually measures your eye misalignment. And then we can offer a solution in your glasses in order to bring that image into a single clear image for you, which can alleviate a lot of symptoms that people don't attribute to when they think of their eyes. Things like headaches or dry eye, again, neck and shoulder pain, motion sickness. So there's a lot of things that can affect us day to day that we might not even realize are part of our visual system.
And that's part of the problem that people kind of just live with, is when you're living life every day and you get used to seeing things in a certain way, or you have a headache, you take a couple of aspirin and it goes away, and you get used to these things, and sometimes you don't wonder why you're getting these headaches, or why you wake up and your neck is a little sore or whatever. But there is sometimes a root cause, and it could be the way your vision is, or the way things that you wouldn't expect.
Well, you started our discussion with talking about how intricate and how detailed the human body is, and I think many of us we adapt and we accommodate to the situation. Our body can compensate for it, and that becomes our new normal. But it happens so gradually that you don't realize what actually caused the problem. So by coming in for that full exam and getting that thorough evaluation, we can detect what your issue might be, and then fix the problem and hopefully make your life a lot more enjoyable.
Well, that's interesting. The practice of going to your doctor regularly, your dentist, your eye doctor, getting regular checkups for your health in general, a lot of people don't do that. You might want to consider that to be part of your regular routine if you're concerned about your health. So many people don't do that and don't think about that, and kind of maybe tough it out if they have little niggly headaches here and there. Anyway, we're out of time for this segment. We'll come back. We're going to talk about technology and what's on the horizon for eye health when we come back. Welcome back to The Big Picture, and my guest is Dr. Michael Murphy from Clarence Eye Care, which is on Transit Road in Clarence. And unless your body is absolutely perfect, not many of us are, but some of us, then you might want to pay attention, because this is a good talk about eye care in particular. And you mentioned that you had a machine that does an alignment on the eyes. And I hadn't heard about that before, because I have a daughter who does have a little bit of a problem with comprehension on reading, because her eyes don't align properly. It's not dyslexia, but the results are similar. Her ability to absorb off of the page is hindered because of her alignment of the eyes. She's had to have an operation, actually, because of that. And if you have a problem such as that, it translates to everything, because when you're in school, you have to have everything on the page, and you have to, that's where you get your education. Even if it's mathematics, it comes from the page. So tell me a little bit about that machine.
That's an excellent point. So there are a lot of kids out there that go misdiagnosed, or they're not diagnosed with these concerns or issues that could be addressed much earlier in the presentation. But this device allows us to do a really good screening on patients. First of all, we give them a questionnaire, which asks them 7 questions how much do they have symptoms regarding motion sickness, dry eye, headaches, neck, shoulder pain. And then we use the device. It's about a 3-minute test, and they track a little submarine propeller, both in the distance and up close. And then the machine tells us what their eye alignment is. And then based off of that, we can prescribe the proper prescription, both with clarity for their vision, but also alignment so they can see a single clear target. Your trigeminal nerve, which is cranial nerve 5, connects your eyeball to your C2, C3 in the back of your neck here. So you can have any disruption or issue along that entire pathway. Dry eye, headaches, neck, shoulder pain, spatial orientation, motion sickness issues. So we're excited to be one of the few practices in the area that actually has the technology. We've had it since August. We've had fantastic results. And we would encourage anyone that has symptoms that you describe here, come in and get an evaluation done and see if they would be benefited from the technology.
So if your child has reading problems, it could conceivably not be just, that they're not good at reading. It could be that they have an actual vision problem that's hindering them absorbing things from the page.
Absolutely. So comprehension is affected by the speed at which children are able to read. So if they're losing their place on the page, they're having to rework and reread, it's affecting their comprehension skills.
And that could be more common than people believe. You had in your practice too something that I don't think any of the other eye doctors in the area had. We talked about this a few years ago. It was a contact lens that you could wear, and it wasn't just for kids. Any age group could wear these. It actually formed and correct me if I'm wrong, formed the shape of the eye overnight, so that when you took these contact lenses off in the morning, your eye was formed properly so that you had clear vision through the day. And then you wore the contacts again overnight to repeat the practice, so that you could actually go, if you were normally someone who would wear glasses, you could avoid having to wear glasses by using these contact lenses overnight.
You've got a great memory and a great description.
Okay.
We take something called a corneal topographer, which is a device that maps the curvature of the cornea. And then we take your prescription, we incorporate that into a software program, and we custom design a contact lens that you wear when you go to bed. So that lens gently reshapes the curvature of your eye while you're sleeping, so that when you wake up in the morning, you take the contacts out and you can see all day like you have your glasses on. And then at night, like recharging your phone, you recharge your cornea. So you put the contact back in, and then you're good to go for the next day. The beauty of this technology, and it's been around since 2004, but it's really, and even before that, but it's really just starting to catch on now, is it actually slows the progression of nearsightedness in kids. You can slow the rate of progression by 50 to 60%. The reason that that's important is because as we become more nearsighted, our eye becomes longer in length, which changes the structures in the back of our eye, making us more at risk for things like cataracts and glaucoma and retinal detachment. So if we can keep the eyeball its more natural shape, we can actually help protect younger kids today from developing eye diseases later on in life.
Wow, and that's something that really not a lot of people know about, and not a lot of practices have that this technology. Are there any downsides to this? Why don't more practices use it?
I think the learning curve is a little steep for practices to educate parents and kids. I think that the cost can be a barrier because it's not inexpensive. Think of like braces for your eyes. But I do think that there's an awakening now, and that more practices and more parents are aware of the technology and understand the long-term benefits that it gives. So it's really just about education.
Interesting. That's interesting. The technology, the medical technology when it comes to eyesight has progressed. I mean, you've been in the business for a while now. What have you seen over the years? I mean, that's one example that we just talked about, and the eye alignment, that's another example. What are some of the things that you have seen over the years, the progress that's happened when it comes to eyesight and helping people see better?
I'll talk collectively for the entire profession, because I think it's, we all are striving to serve our community and give our patients and our community the best vision. But there's been big advances in laser vision correction. There have been big advances in cataract surgeries. We used to only be able to correct people's distance vision or near vision, leaving sometimes their astigmatism, the shape of their eye, uncorrected, so they would still have blurry vision and have to wear glasses. But now the technology is out there where you can put a multifocal lens implant in the eye and correct the astigmatism. So we have a lot of patients that we're sending out that have significant cataracts that come back and are now able to drive and read and do everything without glasses at all.
That is something we hadn't got into, and that's the laser correction for vision. A lot of people get that kind of an operation. And years ago, when it first came out, I've talked to people who had it, and the results were good, but sometimes problematic. People had questionable results. That's now not the case. Most people have good results, but correct me if I'm wrong. When you have a laser surgery on your eyes, you get vision, either distance vision. I think that's mostly what they do, is distance vision. You still have to wear glasses for close-up reading?
That's correct. So the lasers right now only correct the distance vision. I do want to be clear, I do not do surgery. I'm not a surgeon. However, I'm involved with my patients as far as helping them make the best decision for the type of vision that they want. So there's a lot of information out there. Working with me, asking questions, understanding my patient's lifestyle, I can help guide them to the best decision surgically, or glasses or contacts that they need to make for themselves.
Okay. And one last question. We only have a minute left or so. Years ago, I had an injury to one eye, and they had to put a lens in. And I had that lens in for distance. And I had good vision up close. So basically, I had one eye that saw good up close and one eye that was corrected for distance, and my eyes adapted. So I could, even to this day, I have good distance vision and good close-up vision. Is that, I guess psychologically you get used to that. Your eyes adapt. When you're looking in the distance, one eye is taking over, and then close-up, the other eye takes over. When they do eye surgeries and things like that, they don't do things where one eye is distance and one eye is close-up. Is that,
you
or
can? It's still an option. It's still an option. But to your earlier point, that works for you, and you adapted to it, and it's worked out great. And we have a lot of patients who do monovision, is the term, one eye far, one eye near. And so we can customize the treatment based on the patient's adaptation and what's going to work best for them.
Okay, but not many people do that. I'm just wondering.
It's a much lower percentage than what used to do it, because the technology is advanced to allow us to give good binocular vision with both eyes now.
Okay, all right. Well, we're out of time for this big picture, but that's been an interesting conversation. Your health is all that you have, because if you don't preserve that, then the rest doesn't matter. You really can't do much without your health. So have a checkup, whether it's because of your eyes, because of your general health, your general practitioner that you see once a year. Something you shouldn't overlook. Many people do. Many people just don't like going to their doctor. I know people like that. But you know what? Get somebody you trust and do it for your own good. Anyway, thank you for watching The Big Picture, and thank you for watching WBBZ-TV. We're your station, and we appreciate you watching us. We'll see you next time on The Big Picture.